Okay, we move now to item G6, Fiscal Recovery Funds Request Overview.
The recovery grant process closed on August 6th, 10 days ago, and the community really responded. We're going to quickly walk through the requests by category, and so we've broken them out. And then at the end, we really need some feedback from the board. And so we'll start with after-school programs. We received $2.3 million of eligible requests in that category. In terms of child care programs, these are daycare programs, we had $2.7 million of eligible requests. And again, those eligible entities included Families First, the Logan Community CDC, and McGill Baptist. On the behavioral and mental health category, this was a significant one. We had almost $21 million of requests in this category. On the disparities front, and so again, this is aimed at addressing healthcare disparities, education disparities, et cetera. It's all outlined in the regulations. We had $2.6 million of eligible requests. In terms of food assistance, we had $3.2 million of eligible requests. We had $1.8 million of healthcare requests. On the housing front, again, this is a very significant request, and so we had almost $36 million of requests in the housing category. We had $2.2 million of requests in the job training category. And then these last two buckets are more general requests, and these are the legislation as written allows us to address lost revenue. And so on the left side, you see nonprofits. And so we had about $6.3 million requested for lost revenue experienced by nonprofits. From small businesses, we received requests for lost revenue totaling about $13 million. And then the last two categories are substance misuse. We had a $2 million request there, Families First, Hope Haven, and the Partnership for Children. And then the last one is tourism, which is another eligible category, and that was almost $1 million, and that's from the Cabarrus Arts Council. The next couple slides deal with internally identified projects by the county. The first large opportunity is recreation. So that's about $24 million, and as you know, we have multiple parks that need amenity upgrades, from the Courthouse Public Plaza to the Northeast Park ball fields that we're dealing with in Mount Pleasant to Rob Wallace Park. The Cabarrus Health Alliance has requested about $3.3 million, and you can see there the type of requests they've received. They sent over community health workers wanting to open a Concord facility, and then also a mobile health clinic. And then the last two items that we've identified, and some of these are a work in progress, particularly under the utility category. And so this is primarily stormwater and water improvement projects. And then the last one, which is a very small number, are just our departments have identified COVID-related expenses that they have for PPE, cleaning supplies, et cetera. So to put that all in perspective, that totals $124.1 million of requests. We have just over $42 million of funds that we are expecting. And so as you can see, we have some tough decisions before us in terms of what our priorities are. And again, that is what we are looking for tonight.
To me, the areas that should receive the greatest attention first are the people that have been damaged by the events of the past year.
This is very difficult to do from looking at these broad categories and these large numbers and knowing that we can't even do a third of it hardly. So, I mean, when I look at it, I think I would lean toward the housing, the mental health, the child care, and the Health Alliance. But it's really hard not to mention several more of these.
I will tell you the three lowest items on there are categories. So from nonprofit, child care, substance use, those rows, those are easier to fit in because the dollars are much smaller.
I think as you start to drill down on what those actual
Right, when you get
requests
to the
are,
projects, when we know more, yeah.
So you may, it may be that you say, okay, let's target that particular project.
I think they're extremely important, but when it's compared to housing and mental health, I'm afraid it would have to come in third for me.
Thank you very much, and it's very encouraging that folks have participated in the process. Hopefully we can make good decisions.